Hi everyone, my name is Michele. I am a graduate student at CUNY. I'm also a research intern at Nanit, and I'm going to be talking about our project that we want to validate the Nanit algorithm for the head position in infants. So I'm going to start by talking to you about the importance of head movements for motor development. And being able to sustain the head is very important for infants as it allows them to explore the environment where they are. It will allow more complex interaction with their caregivers, as we can see on the picture on the right. It will allow infants to start feeding themselves around 6 months. And also when they are able to hold their heads by themselves, they are able to develop more complex skills. So as we see here on the left, this infant is able to hold his head. So he's able to sit by himself. After that, he's able to look at the toy and then raise his arm to reach. And after that, they are going to be able to do crawling and other important skills that will just happen if they are able to sustain the head. And when we think about the development of the control of the head position, of the head movement, that will happen usually between birth and the 3rd month of age. And that will go with a progression of increasing control of head movement and increase of range of motion. And how that happens is usually infants will perform movements from the body midline to one of the sides, because that will not require going against the gravity, so we require less strength. And after that, they will perform more movements coming from one of the sides to the midline, because that will require strength. And the last one are performing movements from one side to the other, because that will require both range of motion and control and strength of the muscle. And then after 2 months, we can see the infants are more able to stabilize their head in the line with the body of midline. And movements are increasing speed and active range of motion. And by 3 months old, they can control this movement and perform movements in greater range of motion. In 1994, they created a campaign back into sleep because of the increased number of sudden infant death syndrome. And that led infants to spend more time in the supine position during the day. And spending more time in the supine position, that increased the likelihood of infants developing torticollis. And torticollis is a shortening of the sternocleidomastoid muscle in one side of the neck. It's usually presented as a tilt of the head to one of the sides with a turn of the chin or the head, usually to the opposite side. As we can see here in this picture on the left, this baby with the tightening of the muscle on the right will turn his head usually to the left and will bring his ear closer to the shoulder on the right. Usually during examination, the torticollis can be palpable, so you can feel a hard muscle, a hard mass in the muscle where it's affected. And it's usually present at birth, or it can be acquired within the first 4 to 6 months of life. Torticollis can be congenital, and that can be rare, but usually if it is acquired, it can happen up to 16% of all the live birth. Usually male infants are more affected than females. And when we think about motor development, they usually present a strong head movement preference to one of the sides. It can be associated with the plagiocephaly. So because infants tend to prefer one of the sides, it's common that they present this flat spot on their heads and can also lead to a facial asymmetry. The preference of the head to one of the sides can also lead to developmental delays. So they tend to prefer to roll over one side. They tend to use more of one hand, which is not expected at this age, because usually in infancy, infants tend to explore and have a huge variability when we think about use of both sides of looking at both sides, using both hands and feet. So it can be a red flag for us if we see a strong preference. So when we think about torticollis being congenital, it's usually due to a mechanical constraint in utero or a birth trauma. It is usually related to neuromuscular abnormalities that will lead to the shortening of the muscle. It is less commonly related to bony abnormalities or skin web or central nervous systems disorder. And when we think about the acquired torticollis, so our goal here, and the most frequent one, it's usually secondary to an acute process resulting in the spasm of the sternocleidomastoid muscle. It can be related to ligamentous or muscle injury, strenuous activity, or sudden position change. And it's often related to increase in this time spent in supine position as a related one of the consequences of the Back to Sleep campaign. The torticollis treatment will usually involve taking infants to physical therapy, which will work through increasing active and passive range of motion of the neck. And after this intervention, doing caregiving education so they can integrate all these interventions into the baby's routine. And that can be, for example, doing some stretchings, increasing tummy time or face time so infants can get stronger in their neck muscles. And also doing environmental adaptations. So they will increase infants turning their heads towards the other side or putting something that will restrain their movement and their head can be more centered. And also physical therapy will make sure to identify and address potential motor delays that infants may present. And so what does torticollis has to do with sleep? So infants present this strong preference of their head to one of the sides, and this will also persist when infants are sleeping. So that's how we got interested in this. And also when infants are going through a treatment, then they show improvements in their head position, showing more preference to the other side or more centered head. This will also reflect on their sleep. And so Nanit created this algorithm to get information about head sleep during infant sleep. And with the algorithm, we can get information if infants are with their head more toward the right, center, or left. And so we're going to get the proportion of head position during the night. It is important to mention here that the algorithm will take into account if baby is sleeping on their back, on their tummy, or on the side to make the conclusion if the head is center or one of the sides. Here I have an example of one of the nights. So you can see the head position and the proportion of right, center, and left. And we can get information of every night, and this is accessible to parents too. So we created this study because the literature does not bring information about the head position of infants during sleep. And because there's no threshold about the typical head position during sleep. And our goals are to validate the head position algorithm created by Nanit, and we want to create a threshold for typical head position during sleep based on the data that is provided by the algorithm. And we question what is the reliability of the Nanit algorithm for head position, and are all infants likely to have head position preference, or only infants diagnosed with torticollis? So for this study, we included two groups. The first group was a control group, and we included 19 infants. They were recruited between 1 and 3 months old. They were all typically developing full-term infants without any other factor that could affect their head movements. And the other group was a test group. So these infants were 18, and they had torticollis and or plagiocephaly. And so they all passed through this screening to make sure they were eligible. And after that, we did 3 interviews. And in these interviews, we want to make sure for the control group that any of the babies didn't have factors that could affect or really show signs of torticollis or plagiocephaly. And for the test group, we wanted to understand where they were with the diagnosis, when they were diagnosed, and how was the treatment going. And after doing this first interview and making sure that they were all eligible for the groups that we wanted, we collected videos and the algorithm data for 12 weeks. And so here, more information about the interview. So for all the babies, we got information regarding their birth, their motor milestones. For the test group, we understood more about their diagnosis, the severity of their torticollis and plagiocephaly, when was the case, of the treatment. And we did for all of the babies examination of head shape, range of motion, tightening of the neck muscles, how they were doing with motor milestones. And we also did the muscle function scale. So you can see here on the right in this figure. So this is a very common task to do to test how infants are doing with the neck strength, because you can compare one side to the other. So usually by placing the infant turning to one of the sides, you see how they are able to lift their heads. And usually if infants have a torticollis, they are going to have at least 2 points of difference. So you're going to see a clear difference between one side and the other to make sure that they really have something that we should suspect. And here we have these pictures at the bottom. So this is one of the babies, the test group, the picture on the left. So you can see a slight tilt to the left of the head. And this is confirmed by the parents' information saying that the baby really tends to stay with the head tilted to the left. The picture in the middle saying test group. This is a baby with both torticollis and plagiocephaly. And you can see here the flat spot on the head. And the third picture, the control group, you can see the round shape of the head, more as expected in the typical development. So as we collect the videos, we do the video coding, use data view. So we enter the videos, and here you can see in this column that we collect head rotation. So we collect all the time of the videos where infants are with the head either to center, right, or left, and for how long they stay in each of these positions. And we are also coding the tilt to right or left, because this is something very commonly present in torticollis. And here we have more information about the algorithm. So what you can see here on the right is a picture of the dashboard. So that's how parents see information about the head position of their babies. And we have been collecting this information for 12 weeks, so we can compare the manually coded data with the algorithm, so we are able to verify and validate what the algorithm has been generating. So this project is ongoing, and we are still collecting video and algorithm data. We are still coding data, and we are finishing with the follow-up interviews. But we expect to find that the algorithm generates reliable data when compared to the manually coded head position. We expect to find differences between test and control group regarding the proportion of head position during sleep that will reflect on this algorithm data. And we expect to find differences between groups that will allow us to create this threshold for typical proportion of head position that will facilitate in the future early detections of abnormalities during sleep to be further investigated by infants pediatricians. Thank you.
Fantastic. Thanks, Michele. That was a fabulous presentation. I just wanted to acknowledge that we have, well, that Dr. Berger actually has received funding from the NSF to fund Michele's internship and to fund this work. So we're very grateful for that funding, and it really has been a fabulous project, and we're excited to see the results in the coming months. So thanks again, Michele.